Welcome to the webinar. Today we're going to be talking about how you can avoid a nasty surprise charge in your retirement that could completely eliminate your Social Security payments. Very important. We're glad you're joining us today. My name's Alicia Hicks and I'm your moderator. The information in today's webinar is hosted by American Wealth Strategist. Mike Miller will be walking us through information, very important information today. Mike is the Director of Operations at American Wealth Strategist. He has over 40 years of business experience, which means he knows a lot and he's seen a lot, and he's going to share that with us, some of that with us today. We don't have all day for the 40 years of business experience. He directs a team of tax and legal experts, and he brings a client experience at American Wealth Strategist that's unmatched in today's family office industry. And with that, hello, Mike.
Thank you, Alicia. Always appreciate a good introduction. I'm glad everybody is joining us today. And listen, I am really pleased to talk with you about something that's really important to me to share because I got blindsided by it. But let me take a minute and tell you who American Wealth Strategist is and what we do for our clients. So American Wealth Strategist is a multi-family office assisting business owners and other successful individuals through our team of tax, legal, financial planning, wealth management, and insurance experts. As a registered investment advisor solicitor, we and our strategic partners are fully licensed for tax, legal, insurance, and securities. So, listen, you're in the right place if you are about ready to apply for Medicare, or you'll be soon applying for Medicare and Social Security. Maybe your parents or loved ones approaching that retirement age and want to avoid 3 hidden taxes in retirement. You want to ensure that you don't outlive your money and that you have complete control over your cost and benefits. So here's what you're going to learn today. If you're like me, I was excited to get on Medicare. But I was amazed to find out when I applied for Medicare and Social Security that the government planned to tax my retirement income, and they're going to be very sneaky about it. The government calls this a surcharge and a penalty. They don't call it a tax. And it's really worse than a tax because the government can increase these surcharges and penalties without going through Congress like they would have to do if it was a real tax hike. So as a result, this is essentially a hidden tax on who the government considers wealthy, which includes me. So let's take a look at the situation. To get your Social Security benefits, you must enroll in Medicare whenever you are first eligible. Right now, that's at age 65. So you might not know that you have to sign up. You don't have to sign up for Social Security at 65, but you must sign up for Medicare. The Affordable Care Act requires that everyone have health coverage. And if someone doesn't enroll in Medicare at age 65, there are late penalties for those individuals. Now, this late enrollment penalty rule requires that a person pays a surcharge, and this is an additional premium for each 12-month period that they were not enrolled. And you would be paying that surcharge for life. So what are the late penalties if a person delays enrollment in Medicare in addition to the surcharges? Well, a person could forfeit all current, future, and past Social Security benefits. Now, I want to repeat that. A person could forfeit all current, future, and past Social Security benefits if they don't enroll in Medicare at age 65. And it's really surprising to me how many people don't realize that they have to pay for Medicare. And others don't realize they could lose Social Security if they don't sign up for Medicare. So what a person pays for Medicare started being tested by income in 2003 during the Bush administration, which is simply a tax on the wealthy. The cost of Medicare and how much your Social Security is going to be reduced is determined by your income at the time you apply for Medicare. The more you make, the more you pay. Now, this is actually a triple tax in retirement. You're taxed once you make it, you're taxed when you take it out, And then you have your Social Security tax based on how much you have. The cost of Medicare has nothing to do with your health or medical history. The hidden tax, which we sometimes call the hidden boogeyman in retirement, is income related monthly adjustment amount, or IRMA. Now, if you look at this information, Part B is what a person has to pay for Medicare. It's what you and I have to pay, and it starts at about $148 a month. Part D is the drug coverage, which is around $70 a month, and it has an annual deductible. Then a supplement, Plan G, which is also referred to as Medigap insurance, to cover the expenses that Part B doesn't cover, can cost up to $175 a month. So at a minimum, this amounts to over $4,700 for an individual, or nearly $9,500 annually for a married couple. Now, keep in mind that this coverage and this expense is mandated for everyone by the government. You can see from this slide that any couple that has a modified adjusted gross income of less than $146,000 a year pays $148 each for basic Medicare. For a couple, that's nearly $300 a month. But you'll notice in the first column, as the modified adjusted gross income increases, the cost of basic Medicare in the second column increases. So if a couple has taxable income of $750,000, each person will pay $504 for basic Medicare. That's over $1,000 a month for a couple for just basic Medicare. And we haven't even considered what happens if the cost of Medicare increases. So you can see from yourself that the comparison between 2021 and 2028, when the cost of Medicare here are already scheduled to increase. So in 2021, you and your spouse, if you had less than $176,000 in modified adjusted gross income, you would pay $9,500 a year for Medicare. But the cost of everything increases in the future. The Medicare proposed brackets for 2028 would require you and your spouse to pay $11,500 a year for the same basic Medicare. Now, this just indicates that Medicare costs are going to increase in the future. And this means that Americans, you and I, must plan for more cost in health coverage in the future. So let me give you an illustration of a 60-year-old healthy couple who wants to retire at age 67. And they earn less than $750,000 a year. And they've accumulated around $900,000 in their tax-deferred retirement accounts. And they want to plan to live up to age 95. Now, this couple will incur nearly $500,000 in health care costs through their retirement. Now, this is an expense that will come out of their Social Security check. So let me ask you, do you think most people are planning their retirement anticipating this kind of expense? And the sad answer is no. And keeping in mind that this cost is mandatory. The real question is, have you been told about these costs and what they're going to mean to you and your spouse and the quality of retirement you've always planned? Now, we know what you pay for Medicare is determined by your income. So what income are we talking about? The really important information is here. The income that the government uses in these calculations is your Social Security benefits, wages that you earn, pension income, rental income, capital gains that you have to report, dividends, including those on tax-free municipals, qualified annuities, traditional IRAs, 401ks, and other traditional tax-deferred retirement accounts. So the government is going to look at all of this, going back 2 years to see how well you planned your retirement and then reduce your Social Security check as a result. So if you planned well for retirement, lots of passive or investment income, this income will be used against you in determining the cost of Medicare that you will pay, the amount of your Social Security check that will be deducted, and the taxes you will incur on that Social Security benefit. I really want to emphasize that your premiums for Medicare will be deducted from your Social Security check. This modified adjusted gross income determination is set in stone and can only be changed by life events such as death or major income reduction. So I'm going to show you a way to avoid this or prevent it in just a minute. But first, let's look at what the real effect is when Medicare expenses are deducted from your Social Security check. Now, the premiums for Medicare are deducted from the Social Security check before you even get it. And what this slide illustrates for a 60-year-old couple is how their Social Security check is going to be affected after the Medicare premiums are deducted. So take a look at the green line, which is the Social Security check for this couple. You can see from this illustration that around age 81, the red line Medicare costs will completely consume the entire Social Security check. This means that after age 81, our couple here will not have a Social Security check. It's completely consumed by Medicare premiums, and now they must write a check to the government for their Medicare cost. Now, this is something that we see time and time again that most people do not plan for in their retirement or their estate plans. This greatly reduces the amount of total money a couple may have that they plan to live on. And the worst part is they have no idea. So now let's look at what effect does this have on anyone earning $750,000 a year from any source in retirement. You can see from this illustration that while their blue line Social Security benefit is going to rise, that total red line Medicare cost is increasing at a greater rate because of their income. And as a result, you can see from this illustration that around age 74, our 60-year-old couple will have their entire yellow line Social Security benefit consumed by Medicare cost. And then they'll have to write a check for their Medicare premiums. So how do you avoid this? And the good news is there are income sources that are not used in the calculation of these IRMA brackets. Health savings accounts, certain 401h plans, Roth accounts, home equity, certain life insurance products, some specific annuities, and proprietary tax strategies developed by our experts at American Wealth Strategists are not included in the IRMA income calculations, and you can provide the same or better level of retirement as the types of income that penalize you. All you need to do to avoid having the high Medicare cost and potentially losing your Social Security check is just simply convert some of the things that you're probably doing right now into income streams that don't penalize you. Now, to find out how easily you can avoid this triple tax in retirement and take control of your future, you just need to book a time to talk to us right now. That's really all you need to do is book a call with us. Don't go into next year without taking control of your future and your retirement. And everything begins with a conversation. And I personally am looking forward to having that initial conversation with each and every one of you. And so that's really what we wanted to discuss today. And from everyone at American Wealth Strategist, I hope you have a great day. And we look forward to talking with you soon.